Hey, what's up peeps? It's Dr. Talbert here again with another video. Today I'm going to be talking about No Shave November and what it means for men's health. So stay tuned. I'm sure a lot of you have heard about No Shave November. That's when men grow out their mustaches and their beards throughout the month of November and try to get through the entire month without shaving. But you may not know that No Shave November was started by a company called Movember. And the goal of that company is to raise awareness about men's health, specifically in the realm of prostate cancer, testicular cancer, and suicide prevention. So I figured with this video, we can dive into the details behind prostate cancer, testicular cancer, and men's suicide. So let's start with the facts about prostate cancer. Prostate cancer is the most commonly diagnosed cancer in men in the United States. Worldwide, 1.3 million people are diagnosed with prostate cancer every year, and over 300,000 people die from prostate cancer every year. Prostate cancer typically grows very slowly, but it also can cause more aggressive disease. In fact, many people are diagnosed when prostate cancer has already become metastatic, and that means when it has spread throughout the body, beyond the prostate. Autopsy evidence has found that 30% of men in their 50s that die of other causes have some evidence of prostate cancer on autopsy. And that number grows as men age. Some studies have found up to 70% of men who die in their 70s have some evidence of prostate cancer. Because prostate cancer is so slow growing, that has made screening for prostate cancer very difficult. The mainstay for screening for prostate cancer currently is PSA, and PSA stands for prostate specific antigen. This is a marker that we can measure in the blood and use it to correlate with your risk of prostate cancer. What makes it difficult though is that as men age, their prostates enlarge, which is a normal part of aging, but that can also raise that PSA, that prostate specific antigen number. And that makes it hard to interpret results. Currently, most organizations in the medical community recommend an individualized decision regarding whether to pursue PSA screening or not. That means that you need to have a conversation with your doctor about your individual risk factors. Some known risk factors of prostate cancer include being African American. African American men typically get prostate cancer at an earlier age and have more aggressive disease. You're also at higher risk for prostate cancer if you have a first-degree relative. That means an immediate family member that was also diagnosed with prostate cancer. If you do decide to pursue PSA testing, typically the testing is repeated every 1 to 2 years to monitor your progress. Whenever I'm having a discussion with patients about PSA, I always warn them about the unintended consequences of getting a PSA checked. Because if the PSA is elevated, whether you have prostate cancer or not, we will have to pursue further testing. And that usually involves prostate biopsies, which can include complications that you need to consider before undergoing PSA testing. So like I said, if you want to do PSA testing, it's an individual decision that you and your doctor have to discuss. Another part of the No Shave November movement is bringing awareness to testicular cancer. There are 9,600 men that are diagnosed with testicular cancer every year in the United States, and over 400 of those men will die from testicular cancer. So it's important to be aware of the symptoms. Testicular cancer usually presents as a painless nodule or a swelling in one testicle. The unfortunate part about testicular cancer is that it's the most common malignancy in men aged 15 to 35. So it's important to be aware of the symptoms and talk to your doctor about any concerns that you have. Previously, men were recommended to do a monthly testicular exam to feel for any masses. But studies have found that doing those monthly testicular exams haven't actually decreased mortality from testicular cancer. And that's probably because testicular cancer has an excellent response rate to current treatments. Even metastatic testicular cancer that is spread throughout the body still responds really well to treatment, which is good news. But men still need to be aware of the signs and symptoms of testicular cancer. And of course, go see your doctor if you have any concerns at all. And finally, I wanted to talk about mental health. Currently, every minute, a man dies from suicide. And in the US, 3/4 of suicides are completed by men. This is a startling statistic and something that we should all be alarmed about. Of course, many men have trouble talking about their feelings, but we have to, as a society, take away the stigma associated around mental health, especially in men. Any man that is struggling with mental health should not hesitate to contact a therapist, talk to a family member, or anyone that's trusted in their life to get help. We all have to work together to improve our mental health. Be sure to check out the description of this video. I'll put some links into therapists and suicide prevention and to the Movember website that discuss suicide and mental health in men in further detail. Now that you know a little bit more about No Shave November, feel free to participate, and of course, if you can, donate to the cause so that we can all help advance men's health. Thanks for watching my video. Be sure to hit the like button, subscribe to my channel, and comment below if you want to continue this discussion with me.